Since early December 2019, COVID-19 has evolved from an isolated disease born in Wuhan, China, to a global pandemic that has spread across the world. From that day onwards, COVID-19 has continued to challenge health systems while bringing the world to a standstill. On the 30th of January, the World Health Organization declared COVID-19 as a public health emergency of international concern. It was around that time that the pandemic started affecting the Eastern Mediterranean region. On the 14th of February, Egypt confirmed its first COVID-19 case. Iraq and Afghanistan confirmed their first cases shortly after that point, more specifically on the 24th of February. On the 26th of February, Pakistan confirmed its first cases. Then, by the 2nd of March, 4 more countries in the EMR confirmed their first COVID-19 cases as well. And by the 11th of March, the World Health Organization declared COVID-19 as a global pandemic. Shortly after that point, on the 14th of March, Sudan also declared its first case of COVID-19. Yemen was the last country in the EMR to declare its first COVID-19 case on the 10th of April. To this date, these countries collectively reported a significant number of positive COVID-19 cases. As the pandemic evolved, residents and graduates of field epidemiology training programs, or FETPs, started gaining prominence, and their role in the COVID-19 pandemic response intensified. With the widespread of the pandemic, their efforts magnified to prevent, detect, and respond to this threat. In responding to the COVID-19 pandemic, FETP graduates and residents were involved in multiple activities, including needs assessment, case investigation, points of entry screening, isolation protocols, transferring cases, contact tracing, risk communication, community awareness activities, infection prevention and control training, amongst others. While people around the world were advised to stay at home, FETP residents and graduates were in the front lines, spending days and nights in the field to respond to the widespreading pandemic. FETP residents and graduates across the Eastern Mediterranean region were involved in needs assessment and case investigations. They were successful in spreading knowledge in their communities. They were involved in risk communication and community outreach activities. In this area, they also developed guidelines for testing and the management of false information. FETP residents and graduates also participated in health information management within their country's health systems. They contributed to enhancing and updating national surveillance systems and developed COVID-19 case definition in accordance with the World Health Organization guidelines. They have also been involved in analyzing relevant data, all to offer informed recommendations regarding the management of the pandemic at different levels. They also contributed to COVID-19 operational research, with papers published from several country programs. FETP residents and graduates across the region were also involved in scaling up their country's readiness and response activities through conducting training sessions related to COVID-19 management of suspected cases, confirmed cases, and lab tests. They also worked in the field where they had an essential role in surveillance and contact tracing. Despite the continuous rise of COVID-19 cases globally, vaccines are becoming more available in the EMR countries, and FETPs hold an important role in promoting awareness of COVID-19 immunization. Throughout the pandemic, they have proven to be an invaluable asset to their country's response efforts, serving as the frontline responders to the COVID-19 pandemic and building health capacities in their countries.